Hello, Dr. Jay Shetlin with you here for our interview series. And as you can see, I'm still in the hotel in Tijuana, so I'm just going to change our background so it's a little more uh, aesthetically pleasing than a hotel room. So I'm here with Gaston Larios here in Tijuana, and we're at the Immunity Therapy Center. And Gaston helps out with Dr. Batista there at the clinic. And Gaston, tell us a little bit about yourself.
Sure. Well, my name is Gaston. I'm a native Tijuanense, what we call. We're born and raised in Tijuana, and very proud of. And which, as you know, Tijuana, where the proximity to the United States is steps away. Our actual hospital is only half a mile away from the border with San Diego. And my role here is I manage everything that has to do with customer service. And part of that has to do with a lot of advocating with patients that come here and their companions.
Okay, so being the advocate for the clinic, helping people with first exposure to the clinic get comfortable and answer questions, that's the part that you play.
Absolutely, absolutely. I mean, people come from all over the world. A lot of our patients come from the United States.
Mm-hmm.
A big part of our patients come from also from Canada. And then we get people from all over the world, including Mexico, obviously. And but for a lot of people, it's their first experience coming into Mexico and coming into a different country. So it's quite a it's quite a barrier of breaking paradigms, etc. And we have to be there to help people out.
Great. Well, you guys have a great clinic, and every time we've come down here to visit and for my wife to get care, I've met people from all over the world, some very wonderful people, and they've all had very good experiences. So to ask you a few questions, what makes your clinic different, or what's so special about your clinic and how you guys deal with cancer or treat patients who are suffering from cancer?
Well, I think, as you know, there is a lot of clinics out there, and we obviously are not against any of them. Everyone plays a huge role on fighting cancer and getting people well. What makes us different is basically Dr. Bautista's experience.
Mm-hmm.
He's been in this industry for a good 20 year plus. Even though he's a young doctor, he's been in the industry for in this area for a long time. So as far as results, he's gotten major results in all these years, and it's that protocol that he's designed based on those results that has made us different.
What got him into this area of cancer treatment?
As you know, he's a licensed doctor to practice medicine,
mm-hmm.
Like all the doctors that work with us. And he went into more into the alternative path because of his experience that he had with his father. Mm-hmm. His father suffered from cancer and unfortunately passed away from cancer. And in that run, while he was a doctor coming to the industry, his father was suffering a lot.
Yeah.
And that got him motivated to say, hey, there's got to be something else that can help people out, and that's what motivated him. The death of his father, to figure out a different way of doing things and helping people out to get this outcome that sometimes it's just miraculous.
Oh, great! So he's been doing this for 20 years. It is alternative.
Plus, more than 20 years. Yeah.
Okay. He's got a few other doctors that work with him there, a fantastic staff. I mean, the energy, the positivity, the love and support of the team and staff there is amazing. And I don't want to play favoritism because I'm going to interview a lot of different clinics and different doctors that are treating this. But I mean, obviously we are partial to you guys because it's been wonderful for Shannon and the people that we've met there. So he's got his medical degree. He lost his father to cancer, and he decided not to go the chemo route and those. What was it that triggered him? And hopefully we'll get to interview him at some point too.
Sure.
But what triggered him to go down this alternative route, or what are some of his favorite tools in the alternative route that he's found that are powerful in helping against the fight of cancer?
Well, yes, absolutely. And I think Dr. Bautista would love to do that interview with you. But from what I've seen in my experience here, it's the success of this program has been a combination of attacking cancer from all angles. He divides this program in 5 different groups. Where he'll have alternative therapies for patients. He'll also have intravenous therapies, immune boosting therapies, ozone and oxygen therapies, and the nutrition plays a huge part of it. So all combined, it's a very robust program, integral program that he has created to attack cancer from every single angle that he can. So to answer your question, is there a favorite therapy that he uses? I don't think there is.
Okay.
I think the favorite therapy is using them all, and that's been the success. And obviously, every condition, every patient is different. There is adjustments to personalize the program based on the condition of the patient. But for the most part, it's attacking it from every single angle that Dr. Bautista has created this program.
It seems like such a brilliant way to do it, because in some of the other interviews that we're doing, we're talking about how Guyton's medical textbook teaches us that our immune system is fighting viruses, bacteria, and cancer every day. And so if our immune system is weak, then cancer is more prominent to take hold and unfortunately take us over. But rather than just fighting with chemo or radiation or just trying to cut out the problem that could grow back, it seems like Dr. Bautista's approach is really boosting that immune system naturally and then doing other adjunct stuff as necessary.
Absolutely. I mean, that's his main goal is to get that immune system working so that it fights the cancer by itself. And based on that, it's the whole program that he's created.
Oh, that's fantastic.
Yeah.
Well, I had some other questions for you. The typical statistics of success rate, treating things naturally as you guys do versus, maybe the Western side, or maybe we leave them out and just what are your statistics, your success rates?
I think Dr. Bautista usually will explain, obviously, like you said, every single case is different. Age, and the type of cancer, et cetera, and the stage. I mean, we get a lot of stage 4 patients that come to us seeking for help. So that, it's if you divide everything, you can get a more specific type of study that you can do. However, Dr. Bautista has seen a 70%
global success rate.
Yes, global success. Thank you.
Okay,
global
great.
Success with what we do.
That's fantastic. So that's the good with the bad. I mean, that's the good and the bad cases. That's pretty phenomenal.
Exactly.
In fairness, I mean, it is cancer. You can't. It's still a tough battle, and there's a lot of variables. But that's pretty amazing.
No magic pill.
Right, and that's a pretty amazing statistic. Because even in our case, we thought we were like through this, but it's sometimes you think you're through and it comes back, and sometimes you beat it with one punch with you guys. I'm sure.
And Shannon has just a great attitude of fighting this.
Yeah.
She's super important.
Yeah, she's phenomenal. So as far as location, why Tijuana for the clinic?
Well, Dr. Bautista is also a native Tijuanense. He was born and raised in Tijuana. This is where he went to college. We had in his generation, the art college here was in medicine. It was considered one of the top 3 in all of the nation of Mexico, which was extraordinary. So we got some brilliant doctors in that generation. Dr. Bautista is one of them. The proximity that Tijuana has with the United States has opened this huge boundary in our city to medical tourism. The whole city after 9/11, the city changed completely. We used to have a different type of tourism. I'm sure you've heard stories about Tijuana, and they're completely true.
Okay.
But it's changed drastically. I mean, 9/11 changed the world, and we weren't any exception. That type of tourism ended in 24 hours, so to speak.
Wow.
And in a couple of years, we really had to adapt. So the tourism that we have now is focused, our city is focused on medical tourism, city of Tijuana. So we have great plastic surgeons, dentists, stomach bypass medical services, and then we have alternative medicine. And we were one of the first ones. Dr. Bautista really was at the verge of just jumping into that action, and was a leader, has been a leader in this industry as far as opening up that side of the medical.
Fantastic. I hear there are 22 natural cancer fighting clinics in Tijuana.
Yeah, absolutely. I mean, there's like 5 of them that have been around for a long time, and we're starting to see doctors come in to Tijuana to invest in that type of medical area.
Just a side question there: how many of those are with a Mexican medical doctor leading the helm versus somebody from a foreign place? Because some of them are very limited in what they can practice naturally in their own countries.
Exactly, and I think that's why they seek it. I think 80% of them are Mexican.
Fantastic.
And we have a few that come in from other countries.
Okay.
Dr. Bautista, I mean, for us as a culture, as a Mexican culture, it's prestige is everything.
Mm-hmm.
So when we choose to go to a doctor, which in my case, I brought my mom to Dr. Bautista 10 years ago.
Mm-hmm.
You choose someone with prestige, and prestige for us in the broad sense is usually the doctor that we know is from here, studied here, and lives here, and that's Dr. Bautista. You know?
Yeah.
And I'm not saying that someone coming in from another country or another city and opening up a hospital, I'm not saying it's not a good thing.
Yeah.
But as a culture, usually we look for prestige. And Dr. Bautista has been very prestigious over the years.
Well, with supposedly 50% of us on the planet likely to develop cancer in our lifetime, there's plenty of business for all these doctors to do it. But I see where you're coming from, and I totally agree with you. To find somebody that what I say, know, like, and trust, that's that prestige part you're talking about.
Exactly.
And he's such a trustable doctor. I mean, he's just so approachable and just a gentleman doctor. And to have that knowledge that he has, and that faith and confidence and belief in what he's doing is really, it makes the patients and their companions feel very comfortable. On that, I read some study a few years ago where they had interviewed several oncologists and found that they said, well, doctors, based on cancer, when somebody presents to your office, what are the number one tells whether they're going to beat it or not? Is it the type of cancer, the location of the cancer, the age, the sex, where they live? And they said the number one thing was attitude, is what they said was the most important thing. Can you share some thoughts on that?
Oh, sure. Well, that I can talk about because I see it every day.
Yeah.
It's huge. I mean, it's amazing how the power of the mind sometimes surpasses the power of the body. And when people come in very open-minded, very positive attitude, with their expectations open to whatever, if I get better, that's great. If I beat cancer, that's awesome. It's all these things, being spiritually grounded, plays a huge role. And not only on the patient, but sometimes we see it a lot with companions. When you have a good person, sibling or husband or wife, or just friend that comes with a patient, they play a huge role. They play a huge role in the outcome of the patient beating this battle. And so it's hard to explain, but it's amazing from my point of view, from my standpoint, me being in the customer service area and not in the medical side. Sometimes I can tell when people kind of like put a lock, if they're not almost resistant, if you want to call it. We see people that, maybe a spouse is bringing a person, but they're not receptive for it, versus that person that comes in with a great disposition, open-minded, open heart, and just really believing that it's going to work. Once you have that, I don't think what route you take, it's always going to be a better outcome than what you expect.
That's great. Well, I noticed that with your system, I even have an orientation day for, it's like an hour or something for uh, the supporters, the companions, and the people starting therapy there, which I think is brilliant, because if knowledge is power, and when they feel empowered when they understand what's going on, what's different about your place, I think you've got a brilliant system. Well, let me just ask you this, because this is a point blank personal question. What would you do if you obtained the diagnosis of cancer?
I'll be here.
You'd be there, huh? So that's a powerful thing right there. I mean,
there's no doubt about it.
Yeah.
There's no doubt about it. Shoot it with everything we have.
That's great.
And get that immune system going and try everything. Everything. Why just go to what we think has always been the tradition when there is something else? I'm a living example. My mother suffered colon cancer 10 years ago, and she's still with us. And part of the success was bringing her here to Community Therapy Center with Dr. Bautista. And at that point, I didn't know I was going to work here, but
yeah.
but yes, absolutely. That was part of her success.
Fantastic. Well, Gaston, I just want to thank you for taking the time today to help people be introduced into other alternative ideas that are out there to treat cancer.
Dr. Dave.
Two, your clinic directly, that you have a passion enough about to actually spend your time working there and serving the community that you. So thank you so much.
You're welcome, Dr. Dave.